Hello, welcome to this presentation about Employee Benefits 2025. This presentation is specifically for our employees and scholars and fellows who are eligible for what we call on campus the grad benefit program. That will include certain short-term academic staff or short-term faculty as well, those who aren't eligible for the Wisconsin retirement system. My name is Thomason Propson, and I'm one of the benefits specialists who works here at the UW-Madison to assist employees like you with your benefits questions. As you review today's session, should questions come to mind, please feel free to reach out to my office, email us at benefits@ohr.wisc.edu, and use our website to find brochures and other resources that will be helpful. Our website, of course, is hr.wisc.edu/benefit/grad. If you're new on campus, you'll also want to get to know your local human resources contacts within your own school, college, or division. And if you're not certain where to start to find that contact, go to our website, and in the contact section, you'll find a list of HR contacts across campus and find your own school, college, or division. The reason why there are multiple contacts on campus is because there will be different reasons for you to reach out to different people. For example, your local HR office is whom you'll reach out to when you have org chart questions, or you want to know more about your unit policies, or you want to take time off. You need to talk to your local HR contacts for that. Otherwise, my office, the Office of Human Resources, will be able to provide you with benefit details. We can show you where on our website there are brochures and enrollment forms. Otherwise, the system overall, the Universities of Wisconsin, has resources on their websites, including benefit summaries and quick guides, and even a benefits walkthrough that could allow you to imagine the different types of insurance plans you may want to elect and add up the cost if you were to enroll in everything in which you're interested. So that could be a useful tool as you weigh out what to enroll into and what you decide to waive out of. As you learn more about your benefits, you'll also need to learn more about the Wisconsin Department of Employee Trust Funds. They have a health benefits decision guide that they update each year, and into it they publish the different types of benefits that are being offered to us by the state of Wisconsin, the coverage overviews, so things like health insurance, dental, vision insurance, and the price that we will pay for each of these plans if we enroll into them. So each year you can compare and contrast the sponsored insurance plan details and prices. After watching today's session, you will know how to identify your enrollment deadline, review your plan options, and how to send to my office your insurance elections and waivers. The plans we're discussing today will include the health insurance program, as well as life insurance, which is a program that's being offered to you as an enrollment now while you're a brand new employee, but may not be open to you again in the future. So pay special attention to it when we get there. We'll also talk about the supplemental insurance plans like dental and vision, accidental insurance, and flexible spending accounts and retirement programs. The benefits that we're discussing today are for our grad assistants, our scholars, fellows, and postdocs, also called employees in training, and for our new faculty and academic staff who may be eligible for the grad benefit program rather than the Wisconsin retirement system. Now, if you're not certain whether you're eligible for these benefits, check with your local HR or payroll contact within your school, college, or division, and they can help you. I also want to point out that if you are faculty, academic staff, or a limited appointee who is today eligible for the grad benefits rather than the Wisconsin retirement system, changes in your employment could change your benefits eligibility. So please do take a look at the next few slides that are part of the deck available on our website to learn more about how changes to your future employment may change your benefits. In this first part of our presentation, we'll talk about how you as a new employee have a certain amount of time to learn more about your benefit options and make your decisions, share them with my office. We'll talk about what those plans are available to you, and we'll touch on whether or not you'll have future opportunities to make new decisions about your benefits, even once you're no longer brand new. As a new employee, Newly eligible for benefits here at the UW, you have 30 days, 30 calendar days from your benefits eligible start date to review your options and share your decisions with my office, whether you're enrolling or waiving. My office has to receive your benefits choices by deadline, so by the 30th calendar day on or after your initial new hire benefits start, for us to honor your elections. And as you consider your options, there are many of them, think about what you need now and for the rest of this year, as well as what you might need in the future, whether it's a near future or a further future. Because some of our plans are easy to enroll in as new employees and easy to remove. Others are more difficult to enter into and can't be canceled in the middle of a year. Our most flexible plans are these on the screen here: our accidental death and dismemberment policy, our pre-tax parking program, and our supplemental retirement plans can be elected into and canceled out of at any time of year. So whenever you decide to enroll into them or cancel out from them, you're able to do that. However, most of our plans have only certain enrollment or change opportunities. That includes the health insurance, accident insurance, dental and vision insurances, and our flexible spending accounts. So these plans can be elected when you're a new employee so that you have the coverage for the rest of this year. Or if you choose to opt out or waive them now, you could perhaps elect them in the future, either due to a life event like a marriage, or during our annual enrollment period in the fall for coverage to begin next January 1st. Our life insurance plan, however, has a very restricted enrollment opportunity. So you can elect now as a brand new employee within your first 30 days, but if you chose not to enroll now, you may never be eligible to enroll in the individual and family life insurance in the future. So do think carefully about this plan when we get to that section. The date your coverage will begin depends on whether we receive your application timely, and then it will also depend on your employment start date and the type of insurance we're talking about at that time. So as I review each type of insurance benefit, I'll also touch on when their coverage will begin. You should also know that certain life events will allow you perhaps a new 30-day window to apply for changes to your benefits. But not every life event allows the same types of changes, and each event may affect different insurance plans in different ways. So our website has more detail for you. If you go to the qualifying life events section, you can learn more about how a loss or gain of other coverage, or the change in family, like a marriage or a divorce, or the birth or adoption of a child, might affect your benefit elections. And in the copy of the slides that you can open via our website, you can also read more about special life events, like for international employees whose family isn't yet with them in the US, but who plan to join them later, or for employees who haven't yet turned 26, but when they do, they'll lose their parents' coverage. Read in more detail about those life events that may be particularly important to those of you in the grad assistant programs. To enroll in your benefits, you'll first log into Workday. You can find Workday at the MyUW portal, and then by clicking Launch Full App on the Workday tile. Then click Menu in the upper left corner of the Workday menu, and find under Personal the Benefits and Pay link. Here's a screenshot of what that Benefits and Pay link or hub may look like. Obviously, your own information would be listed rather than in this example. If you are able to make changes to your benefits or enroll as a new employee, there should be options in the Change Benefits category. And you'll see when you open that screen, under Instructions on the right-hand side, there is a link that will take you to a further benefits portal called My Benefits. It will be on this My Benefits website where you will actually submit your different benefit election choices, including enrollments and waivers. You will want to set up your My Benefits account using a personal email address. We do not recommend that you use your UW-Madison work email. And remember to do this and submit your benefits decisions, even if you're going to waive, by your 30-day deadline. The first time you access My Benefits, you will need to register for a My Wisconsin ID and set up your account. So just be aware that this will be an initial registration process. And another more direct link for My Benefits is listed here on the screen, apps.etf.wi.gov/member portal web. When you are able to log into My Benefits, you will be able to view how many days you have left to elect your benefits and any to-do items that are still outstanding. The days left to elect benefits will count down until you've reached your deadline, after which you cannot make new hire elections. And from this page, you can hit Begin Enrollment, which is where you can review and make changes to your election at any time during your eligibility period. The To-Do Items category is asking you to review or perhaps take action on certain questions. For example, we may need to know more about your dependents. And after you have completed your elections, you'll hit Confirm or Confirm Changes, and then you will have active benefits to view. Now, if you find you cannot get online, please contact your local HR or payroll for assistance and make sure that you're doing this before your deadline to enroll. Because even if you're not able to get online with your own computer, you still must submit your new hire selections by your 30-day deadline, and your local HR can assist you with that. Now, our paychecks are sent to us bi-weekly every other Thursday. That may be 26 times over the course of a year if you're employed all 12 months. It may be nearer to 18 paychecks if you're working just the academic year. And for your insurance benefits, the cost of your insurance will be deducted from your paychecks. The premiums that you pay are divided from their monthly cost into 2 separate payments. And you pay for the first 2 checks each month, you pay your monthly premiums that are due. So the first paycheck you receive in a month pays for the first half of that month's coverage, and then the second paycheck you receive in the month pays for the rest, for the second half of the month's coverage. As a new hire, it can take several paycheck cycles to catch up on premiums due. So don't be surprised if you initially see a full month deducted from a paycheck. That's likely to catch you up on the premiums that had been missed, if they were missed. Again, review your earning statements and let your local HR payroll and benefit coordinator know if you have any questions. Now, I wanted to point out that we do offer insurance programs that could cover you as our employee. You might also choose to cover your legal spouse if you're married. You may also have children that you want to cover on your insurance plans. There are just 2 programs that could also extend coverage to a domestic partner if rather than being married, you're in a partnership. But there are no plans that offer coverage for a parent. And so as we walk through the next programs, the health, the dental, the vision plans, and beyond, just keep this in mind that in general, they're being offered to you or to your spouse or your children, and then perhaps to a domestic partner if you're not married, but none of the programs are being offered to parents or other relatives. All right, we'll start with health insurance, which we on campus also call the state group health plan. And you'll find more detail on our website, but we'll cover the basics here today. Now, most employees want to know how much will it cost if they enroll in our health insurance program, and then if they're enrolled, which doctors can they visit, and what types of medical care is covered, and also what will their charges be from the doctor's office if they receive care. And the answers to those questions depend on which of the plan options you elect. If you do choose to enroll in one of the state group health plans, your health insurance will be effective the first day of the month following your date of eligible hire. Or if your date of hire were to be the first of the month, then your coverage could begin that actual first day of employment, the first date of that month. So in the examples on the screen here, you see Jane starting her benefit eligible appointment on January 14th. She submits her state group health insurance enrollments timely, and so her health insurance will begin February 1st. Tyler, in this other example, has coverage beginning on March 1st because Tyler's start date was March 1st itself. And then Tyler, submitting paperwork timely, has coverage retroeffective back to his start date. There are two different types of state group health programs available to our grad assistants and short-term academic staff employees. So there is one called the It's Your Choice, or IYC, health plan. It's based in Wisconsin, and you would choose either individual coverage just for yourself, or you might choose family coverage to extend coverage to your spouse, to your children, or to both your spouse and your children. And the price you would pay if enrolling in that program would be $64 a month if you have the coverage for yourself with an attached preventive dental plan, or it could be $158.50 a month if you've elected the family option with the preventive dental. The other options you're choosing between is the Access Plan, which is a nationwide program, and it is more expensive to be part of. So if you were to elect the Access Plan, you would pay $150 per month for coverage just for yourself with the preventive dental attached, or you'd pay $372 a month if you're electing the family coverage with the preventive dental attached. Now, with these programs, you could also choose to go without the preventive uniform dental and save yourself a few dollars each month by having removed that coverage. So we'll talk about these two different options. We have the It's Your Choice health plan and the Access plan. And if you're enrolling in health insurance, you'll be choosing one of these. The Wisconsin-based plan requires you to choose a small group of doctors to be your doctors for the year, and then you commit to visiting only those doctors that are part of your network. In fact, if you go outside of your network, you do not have any insurance coverage unless you're seeking emergency care or urgent care. The Access Plan, on the other hand, has doctors across the entire nation, and they allow you to visit those providers across the nation or even go outside of the network and still have the Access Plan's insurance. But if you do choose to go outside of the network, there will be less coverage. It costs more for those out-of-network services. When it comes to selecting your health plan, things to consider include the location of your doctors. You'll need to understand which doctors you can visit and also choose either one of the local Wisconsin-based plans, if that's where you decide your doctors will be, or you might instead choose the nationwide network if you need doctors in many places. You'll also consider the cost of your coverage. Think about how much you'd pay from your paychecks just to be part of the insurance. And then also keep in mind when it comes time to receive your medical care, which price will you pay when you visit your doctor or your hospital for your services? You'll also, before you seek care, want to understand how your plans work. What is the plan deductible and out-of-pocket limit? And what are your pharmacy benefits? That's what we're talking about next. So first off, if you were to enroll in one of the health programs, you have the uniform dental option to attach to your health election. Each of the health plans has an and dental election option. And if you chose that, you'd have Delta Dental, PPO, and Premier providers as part of your annual cleanings and exams, children's fluoride treatments, necessary x-rays. You would have up to $1,000 per mouth per year for those basic routine evaluations and dental cleanings. And this would charge a slight higher cost to your health election, an extra $4 a month if you're on the individual single health plan, compared to if you chose the option without the preventive dental attached. Or it is an extra $10 a month if you have family health insurance, compared to if you chose the health option with no uniform dental attached. If you'd like to read more about what this preventive dental would offer to you if you're attaching it as your uniform dental to your health election, you can visit the Delta Dental website. You can also search for your PPO and Premier providers on their website. So if you're visiting a dentist, you make certain to choose an in-network provider so that they will take your insurance. If you decide that one of the Wisconsin-based plans is best for you, we also call that the IYC, or It's Your Choice Health Plan. Then when it comes time to actually making your election, you'll choose a network of providers to be your doctors for the year. And then you'll learn who those doctor groups include, and you'll only visit your chosen network of providers during the year, unless it's for an emergency. So examples of those provider groups here in Dane County include the Dean Health Plan. They have doctors here in Dane County, as does the Group Health Cooperative of South Central Wisconsin's Dane Choice Network, as does the Courts UW Health Network. So all of those are examples of Dane County provider groups. And if you were to enroll in one and submitted your election on time, you'd be paying $64 a month if you've chosen the coverage with the preventive dental just for yourself, or you'd pay $158.50 a month if you've chosen the family plan with the preventive dental attached. Now, you may not need a network here in Dane County. Perhaps you live and plan to seek medical care in Columbia County or Sauk County or some other portion of Wisconsin. You'll want to review Employee Trust Fund's network choices either in their decision guide or, better yet, on their health plan search webpage. This is an interactive webpage where you can enter the county in which you plan to seek medical care, and it will list the different network of groups that are available in that area. And then you would choose the one network that seems best for you for the coming year. And when you're on ETF's health plan search webpage, you'll see that some of the Wisconsin-based plans even have doctor groups that extend just over the border into surrounding states. So you may, in fact, be living and planning to seek services in the Twin Cities and find a doctor network here based in Wisconsin that still extends into the Twin Cities. So you could choose that network as yours. There are also options that might extend into the UP, into northeastern Iowa, and to northern Illinois. So double check the health plan search webpage if you need coverage just outside of Wisconsin, and one of the Wisconsin plans may still work for you. Now, if you decide having nationwide coverage is in fact important for you, then the Access Plan is there for you. You would pay $150 a month if you have the individual access plan coverage with the preventive uniform dental, or you would pay $372 a month for family coverage with the preventive uniform dental. And this allows you to visit doctors in the Dean Network in southern Wisconsin, as well as the First Health Network all across Wisconsin and nationwide. Now watch for the access-in-state name if you're enrolling online and you want this nationwide option. I know it does say access-in-state, but that is the nationwide option. And if you enroll into it, then even services outside of the Dean and First Health networks are still allowed. They don't have to be for emergencies. Now, how to find the network that's best for you will involve some research on your part. You'll want to visit the different network websites or call their member services line with questions. Find out whether your current doctor is part of their network, if that's important to you, or perhaps choose a network that offers clinics nearby to where you live or to where you work so that it's convenient for you to travel there when you need to see a doctor. You might also ask them about their telemedicine services or the hospitals to which they would send you if you needed care. And all of those together will help you decide which network is best for you for the coming year. All right, so let's say you have enrolled in either the Wisconsin-based health plan or the Access plan, and it comes time to seek care. Here's where we need to talk about what you will pay if you're going in for annual routine preventive care, or if you're going in for diagnostic office visits. We'll need to talk about the office visit copays, the annual deductibles, and the out-of-pocket limits. Let's start with preventive care. Because of the Federal Affordable Care Act, your preventive care services, when billed as preventive, are covered 100%. And there are lists both on healthcare.gov as well as on ETF's website that will tell you what types of services, screenings, or prescriptions are going to be considered as preventive. It's when your care is not preventive that there will be a cost to you. So let's first talk about office visit copays. If you're going in for your preventive routine primary care office visit, then you pay nothing as an office visit copay. But if you're going in to see your child's pediatrician or maybe your mental health counselor, your chiropractor for an adjustment, or your OB/GYN, then there will be a charge to you because you're visiting them in their office. You will pay $15 as the office visit copay. If you're going to visit a specialist, like a cardiologist, or maybe you're going to an urgent care clinic because you couldn't wait for an appointment with your general physician and you needed urgent care, then you pay $25 to visit the doctor in their special office or their urgent care center. Or if you're going into the emergency room because you need emergency life-saving care, then as part of the ER visit bill, you'll also pay a $75 ER copay. That would be waived if you're admitted to the hospital, but if they just patch you up and send you home, then you would owe the $75 as part of the hospital charge. Now, for an example of what this might look like, perhaps you've been having headaches, and so you make a doctor's appointment with your general family physician. The date of your appointment, you check in at the front desk, and they recognize that you're there for your visit. They will likely ask you to pay your $15 office visit copay right then and there as you're checking in. You'll pay the $15. You'll then go in for your office visit. You'll talk to the doctor, and for their time, they will perhaps charge several hundreds of dollars for that visit and consult. You pay your share when you pay your $15, and the remainder of the bill is paid by the insurance company. But sometimes you need more than just a consult with your doctor. You might need x-rays or diagnostic labs or a surgical procedure. And in those situations, you will need to meet an annual deductible at the start of each year, or for the first services you incur each year. So the medical annual deductible is $250 per person per year. So let's say you go in for that headache and you pay your $15 to see your doctor, and then your doctor is concerned about what's happening inside your head, and they order a certain type of x-ray. You pay $15 for the office visit, but you will pay more for the x-ray itself. You would pay the first $250 for its charge. And then if you meet your medical deductible for the year, for the rest of the year, the insurance pays for some of the additional cost of services for the year, and you have a smaller responsibility for the charges. So for your charges after you've met your annual $250 deductible, it's called co-insurance, where for additional medical care like that x-ray, you pay 10% of the cost and the insurance company pays 90%. Or if you were being issued durable medical equipment, perhaps you've broken your arm and you're being provided with a brace, then you pay for 20% of the cost of that equipment and the insurance company pays 80%. Now, if you were to add up the cost of all of your office visits and your annual $250 deductible and then your coinsurance, at most, the insurance may make you pay up to $1,250 for those charges. If you end up meeting that out-of-pocket limit during the year, then for the remainder of the year, additional office visits and medical care and equipment would not be charged to you. The insurance would pay for them. So at most, $1,250 is your share of your covered in-network medical expenses. Now, the pharmacy benefits are slightly separate from the other medical care. The pharmacy benefits through the health plan and the access plan are offered through a company called Navitus. And you can search the Navitus formulary, which is the list of drugs they cover, as well as some drugs that they exclude from coverage, on the website on the screen here, benefitplans.navitus.com/ETF. What you'll find in the Navitus formulary is that certain drugs are covered at certain levels. So some drugs will be covered as preventive, meaning that you pay nothing for them when you fill them at your network pharmacy. But other drugs will be listed as level 1s, meaning that you pay $5 when you fill them at your pharmacy, or level 2, meaning you pay 20% of their cost, but no more than $50 when you fill them at your pharmacy. Other drugs may be more expensive. Level 3 drugs could be up to 40% of the cost, $150, or even more, depending upon whether you have a letter of necessity from your doctor. And level 4 drugs will cost you $50 when you fill them, but you must fill them at either the UW specialty pharmacy or through Lumicera. There are out-of-pocket limits for your pharmacy benefits as well. So if you were regularly filling prescriptions, if they were level 1 and level 2 drugs, at most you would pay $600 over the year for those level 1 and level 2 prescriptions. Or if you're filling regularly level 3 and level 4 drugs, you will continue to pay for those again and again when you fill them at the pharmacy until perhaps you've spent as much as $9,200 per person per year on those prescriptions. So keep that in mind that if you do need to fill prescriptions, there is an out-of-pocket limit where if you fill that much of a prescription, you no longer owe money until the year resets on January 1st. It will be important for you to visit in-network pharmacies when you fill your prescriptions, and you can view which pharmacies are considered in-network on the benefitplans.navitus.com/ETF webpage. You also, with your pharmacy benefits, have certain vaccinations provided to you for free if you show your Navitus card to your pharmacy. So if you're able to receive a flu shot or a tetanus shot, a shingles or measles shot at your pharmacy, showing them your Navitus card will allow you to receive that for free. Here's an overview of the in-network coverage. So you'll see at the top you have the prescription drug copays or coinsurance amounts that you are responsible for. And if you do meet an out-of-pocket limit for a prescription tier, then the insurance will pay 100% for the rest of the prescriptions you fill for that year. If you're going in for your office visits, you'll pay an office visit copay. And if you need services that go towards your deductible, then you pay 100% of the cost of that service up to the first $250 each year. If you meet your deductible, then you pay just 10% for additional medical services until perhaps you've spent up to $1,250 as your share. And then for the remainder of the year, the insurance pays 100% for any other office visits or surgeries or x-rays that you might need. Now, if you need to seek out-of-network medical coverage and you're on one of the Wisconsin-based health plans, it's important to visit those out-of-network providers only if it's an emergency or an urgent care need. Otherwise, your services wouldn't be covered if you're going outside of your chosen network. Examples of emergency care needs where it's allowed for you to go outside of your network and visit just the nearest emergency room include severe allergic reactions, severe asthma attacks, convulsions, loss of consciousness, heart attacks. Those are life-threatening situations where you need to seek immediate life-saving care. So please use the nearest emergency room or your in-network emergency room if you're near to it and nowhere to go. Things that are not usually considered emergencies are milder symptoms, things like fevers without rashes, sprains and strains and sore throats, and most headaches. In those cases, you would often try to contact your doctor's office and make an appointment to see them, or possibly visit an urgent care center. So there could be situations where visiting an urgent care clinic is ideal. If you have a broken bone or a cut, a sprain, or certain mild drug reactions or minor burns, then visiting an urgent care center may be convenient for you compared to having to make an appointment with your local doctor's office. It is important if you're seeking urgent care that if you're in your basic home network, you should visit only your in-network urgent care clinic. Only if you're traveling and away from home and in need of urgent care, then would it be okay to visit an out-of-network urgent care clinic. If you enrolled in the Nationwide Access Plan, there are less restrictions about seeking out-of-network medical coverage. In fact, there are doctors across the nation, so you may find it easy to find an in-network provider. But if you still do visit a provider who's outside of the Access Plan's network, you are allowed to do that even though it's not an emergency or an urgent care need. You will, however, pay more for that out-of-network medical care. So you'd pay 100% of the out-of-network bill up to the first $500, and then you pay 30% of the remaining bill up to as much as $2,000 per person per year. There are more resources about the services that are covered, as well as what would be excluded, not covered, in the plan's certificate of coverage. You'll find this available on Employee Trust Fund's website, and they update it each year. So just as a review, if you were to enroll in one of the Wisconsin-based health plans, you'll pay $64 a month if it's coverage for you with the preventive uniform dental, or you'll pay $158.50 a month if it's family coverage with the preventive uniform dental. If you choose the Access Plan with its nationwide coverage, the cost is $150 per month for individual coverage with the preventive dental, or $372 a month if it's family coverage with the preventive uniform dental. And if you're looking for more details about the plans, want to find out how to contact them via phone, visit Employee Trust Fund's website, where again you can search by Wisconsin County for the various plans. You can also find their contact information and see an FAQ section, because certainly if you have questions on your mind, others have had them as well. And you'll find answers to those frequently asked questions on ETF's website. If you enroll in the health insurance, you will receive ID cards. You'll receive one card from your chosen insurance network, for example, Dean or Quartz UW Health, and you'll receive a card from Navitus to show your pharmacy when you fill a prescription. And then also, if you selected the and dental option as part of your health enrollment, you'll also get a card from Delta Dental for your preventive uniform dental coverage when you're visiting your dentist. These ID cards can take as many as 4 weeks after you enroll to be mailed to you. They're mailed to you directly by the insurance plans. Be sure that your home and mailing addresses in your MyUW portal are updated and correct, and update them should you ever move so that the insurance companies always have your correct address to send you replacement cards. Now, if you're wondering about seeking medical care or filling a prescription before you have your ID card in hand, absolutely that happens. And take a look at the next 3 slides that are part of the deck and read more about examples on how that would work. Another way to show proof that you've been enrolled in benefits, such as health insurance, is to log into your My Benefits portal and go to Print Your Benefits. This way you can have a copy of which benefits you've elected to show as proof of coverage. All right, let's change topics a bit to a new type of insurance, life insurance. Life insurance is a benefit that would pay an amount of money to your beneficiary, a person, people, or charity of your choice, if you die while being covered by the life insurance. You might consider life insurance as an important election if someone in your life relies upon your earnings to help pay their important bills, things like their rent or their mortgage. Or if someone has co-signed on a loan with you, perhaps somebody had co-signed on school loans or a rental agreement or a car payment, and in the event of your death, they would become responsible for those costs. Or you might consider life insurance simply to cover the cost of your funeral. If you do elect life insurance, then you'll want to complete a beneficiary designation form so that should you pass away, the life insurance company Securian knows who to pay the money to. And there are two ways to designate your beneficiary. You could enroll through what they call their life benefits portal, or fill out a paper beneficiary designation form and mail it to the insurance company. It is up to you to choose who your beneficiaries will be. You can choose just one person to receive the entire benefit, or you can note multiple beneficiaries and divide the benefit between them. And whomever you initially choose, you can always change who you want as your beneficiaries by submitting a new form to the insurance company. With the grant benefit program, you have one life insurance option available to you. It's called individual and family life, and you can cover yourself, and the cost would depend upon your age and how much coverage you elect. If you have a spouse, a domestic partner, or an eligible child, you could also elect coverage on their lives. If you don't enroll in the life insurance timely within your first 30 days, and then in the future you try to apply, there is an application called the Evidence of Insurability, or EOI, form, where you share medical information with the insurance company and then wait to hear back from them to see whether they think you're healthy enough and they've approved the application. But this is not a guaranteed way to get into the life insurance. Your application could be denied. So think carefully about signing up for life insurance timely. If you do enroll in the individual and family life insurance as a new employee, you can elect as little as $5,000 or all the way up to $20,000 on your life. If you do elect the full $20,000, you can see the cost as examples on the screen here for you. So for example, if you're not yet 28 years old, you'd pay just 46 cents a month for that $20,000 worth of coverage. Or if you're older, there is a higher price that you would pay per month for the coverage. There's also coverage available for your spouse, your partner, your children. And year after year, if you were to enroll in the individual and family life when you're new, each fall you can boost the coverage levels all the way year after year up to as much as $300,000 on your own life. These maximum coverage levels are meant to be built up gradually. So each fall you'd have an opportunity to increase the amount you'd previously elected. But these increases are only for those who enrolled when they were new employees or already have the coverage. This isn't an open enrollment each fall. It's just for those who are already part of the plan. Life insurance, if you enroll, is effective the first of the month after you've completed 30 days of eligible employment. So in the examples on the screen, we have Natalie, who started employment March 20th. Her life insurance would begin May 1st, the first of the month after she's completed 30 days of eligible employment. Next up, we have our accidental death and dismemberment, or AD&D insurance, and the accident insurance plans. These are two different accident plans with two different providers, and you can enroll in one or the other, or both, or neither. The accidental death and dismemberment policy is through a company called Zurich. Zurich charges a certain amount per month for your AD&D coverage if you elect it, based on how much of a benefit you choose for yourself. It could be as little as $25,000 on your life, all the way up to $500,000 on your life. And you can choose to have the coverage just for you, or you could extend the coverage to also include your eligible family. The AD&D benefit would pay out in the event of your death because of an accident, or in the event that you are dismembered in an accident. So if you died because you were in a car accident, a benefit would be paid out, or if you were dismembered, meaning perhaps you lost both hands or both feet, a benefit could be paid out. If you elected the AD&D coverage for family, and it's a family member who dies or is dismembered in an accident, then the benefit amount that would be paid to you would be a percentage of the coverage you'd elected for yourself. If you elect the AD&D policy, remember that you have the coverage put information about the program in your important papers, and then you will be responsible for filing your own claims with Zurich. If you were to be dismembered in an accident, or if your family needed to file the claim in the event of your death. Claims are usually needed to be submitted within 90 days of the accident. And along with the AD&D policy comes a travel assistance program and an identity theft assistance program. These are just part of the election along with the other AD&D coverage. Your AD&D coverage would be effective the first of the month after you've completed 30 days of eligible employment. So again, we have Natalie as our example, hired on March 20th. Her AD&D coverage would begin May 1st. Now, the other accident insurance is with a company called Securian. Securian charges for its accident insurance based on who in your family you're extending the coverage to. You may have coverage just for yourself, or perhaps you also have it for your spouse or your children, or your spouse and your children. This accident insurance would provide a payment to you if you are injured in an accident and have to receive medical care because of that injury. You later submit a claim to the Securian company, and then depending upon what type of accidental injury you incurred, there would be a benefit paid to you. So here's an example that Securian shares within their brochure. Here's someone who has enrolled in the accident insurance, and then they fall off of a ladder. They break their leg and their wrist. They have to be driven to the emergency room in an ambulance, and they stay in the hospital for 2 days. After all of that is done, they then submit their paperwork claims to Securian, and Securian assigns a dollar value to each of those parts of their claim, and later in this example, sends them a check worth $3,300. And our employee in this example can use that money for whatever they find appropriate. Maybe it helps them pay some of their medical bills, or maybe they don't need it for that, and instead they use the money to pay for their childcare provider or a dog sitter. If you do enroll in the Securian accident insurance, you have to remember to file your own claims. They usually require a claim to be submitted within 72 hours of the accident, and the accidents have to be occurring in the US or in a US territory. An accident insurance election would be effective the first day of the month following your date of hire. So if your start date were January 8th, your coverage could begin February 1st. We're moving on now to dental insurance. Now, I'd previously introduced the uniform dental as part of the health election. If you enroll in health insurance, you can choose to have preventive dental attached to your health election. If you have waived health insurance, you may instead elect the standalone preventive dental plan. You would pay $36.10 a month if it's just you on the preventive dental plan, or you would pay $90.28 a month if you're covering other family members on that preventive dental plan with you. There are also the separate major dental plans, which are called the Select or the Select Plus plans. And those can be elected whether or not you've enrolled in or waived health insurance. They are their own separate elections. So as a reminder, the uniform dental, and this would also include the standalone preventive dental plans, offer up to $1,000 per mouth per year in coverage for routine evaluations, dental cleanings, children's fluoride treatments, and the like. But what the uniform dental and preventive plans do not cover are more major services like crowns and bridges and oral surgery. For those types of services, if you want coverage, you want to elect either the Select or the Select Plus plan. The Select plan requires you to visit Delta Dental PPO providers. You'll be charged a $100 deductible per person per year, and then the plan will pay 50% of the cost of your crown or your bridge or your oral surgery up to $1,000. At most, the Select plan pays $1,000 per mouth per year. If you elect instead the Select Plus plan, you can visit Delta Dental PPO and Delta Dental Premier providers, you pay a $25 deductible per mouth per year, and then the plan pays 60% of the cost of your crown or your bridge or your implant, or 80% of the cost of your oral surgery, up to $2,500 per mouth per year. So at most, the Select Plus plan will pay $2,500 for your mouth each year. Also of note, if you need coverage for orthodontia, the Uniform Dental and Preventive Plan will offer up to $1,500 of orthodontia coverage for your dependent children. They have to be under the age of 19 in order to use that benefit. The Select plan has no orthodontia coverage. The Select Plus plan will pay up to $1,500 towards orthodontia coverage for someone of any age. So that could include your children, or it could also include you or your spouse if you've chosen that coverage. If you do enroll in the dental coverage, you must visit an in-network Delta Dental provider, whether that's the PPO or the Premier provider, depending upon the type of insurance you're using. Be sure that you research and visit an in-network provider so the insurance can work for you. And then your dental insurance would be effective the first day of the month following your date of hire. Next up, vision insurance. The vision insurance is with Delta Vision, and they'll charge a monthly premium based on who in your family you've chosen coverage. So it might be just for you, the individual, $5.75 a month, or you might pay more if you're also covering your spouse or your children, or your spouse and your children in family coverage. Now, the Delta Vision plan will allow you to have a routine eye exam each year, and your cost for that exam will be $15. If you're then getting a basic pair of eyeglasses, you would pay $25 per person for a pair of basic eyeglasses, or you may pay more out of pocket if you're receiving fancier frames or fancier lenses. If instead of glasses, you're purchasing contact lenses, then when visiting an in-network provider, you will pay $40 for the contact lens exam portion, and then you can receive up to $150 as an allowance towards the purchase of your contact lenses. You may have noted on the last two slides that there were columns for coverage if you were visiting an in-network provider or an out-of-network provider. So with Delta Vision, you can visit an out-of-network provider and have some coverage as reimbursements to you, but you'll receive the best level of coverage if you visit one of the iMed Insight Network doctors. So to choose an iMed Insight Network provider, visit the website or give them a call and find a doctor near you. Vision insurance, if elected, will be effective the first day of the month following your date of hire. All right, next up we have retirement plans. Most of our UW employees are eligible to participate in these retirement programs, but you're not eligible if you're receiving a fellowship or a grant to pursue your own study or research, because you're not technically considered an employee of the UW. So if you happen to be a fellow, a scholar, a non-service grad intern or trainee, or most postdoctoral fellows or scholars, then this next section is not applicable to you at this time. There are two optional retirement plan programs available to our grad assistants. There's the UW's 403B program, which is also known as the Supplemental Retirement Program, or SRP. And we have the state's 457B, which is also known as the Wisconsin Deferred Compensation Program, or WDC. Now, these plans are very similar in many cases. Both of the plans allow you to have money withheld from your paychecks, either pre-tax or post-tax. There is no minimum contribution in either case. Neither is there an employer match. So any money that goes into this plan must be through your own paycheck and with no additional employer contribution. You may contribute up to $23,500 into each of the plans in the same year, or perhaps even more if you are 50 years of age or older. Each of the plans has their own admin fees that they charge based on your account balance, and there could be ways to access your deposits even before you retire. Loan services, for example, could be available through the UW's 403B, or hardship distributions can be available through the state's 457B. If you decide you want to enroll in one or both of the supplemental retirement plans, here is how to do that. There is an easy enrollment form if you want to enroll in the UW's 403B, or a lengthier salary reduction agreement form. Or there's the state's online enrollment, for which you'll need the current plan enrollment code, which you'll find in the flyer that we link to on this slide. If you enroll in one or both of the supplemental retirement plans, you can also change the amount you contribute, whether that's to increase it or to decrease it, at any time during your employment. And the directions on how to do that are both on our website, as well as linked to on this slide. Now, perhaps you're coming to the UW after working somewhere else, where you did have that former employer's retirement program. The UW's 403B and the state's 457B plans do allow roll-ins from former employers' qualified retirement plans into these new employer-sponsored programs. You would need to first open an account here through the UW, and then contact your old plan and contact your new plan to work out the transition of the money. If you'd like to learn more about the retirement programs offered to employees at the UW, we welcome you to join one of our future Starting to Save, Mid-Career Retirement Check-In, or Ready to Retire sessions. These sessions are primarily for our employees who are part of the Wisconsin retirement system, but you are still welcome to participate even if you're not part of the WRS. You will likely learn some new language, some new resources about retirement planning, and so feel free to join us in the future. All right, we're near to finishing up today with our pre-tax spending accounts. And while most UW employees are eligible to participate in the pre-tax spending accounts, certain appointees are not, and that would include our fellows, our scholars, and our non-service grad interns and trainees and postdocs. So to participate in these pre-tax programs, you need to be an employee, student hourly, or grad assistant, or in some cases, some certain post-grad trainees are considered employees. And you can contact your local HR if you're uncertain where you fall. So this table shows the two types of flexible spending accounts that are available to you as our employee. There's the health FSA and the dependent daycare FSA. You'll see here the types of eligible expenses that could be run through each of the accounts, who you might call your eligible dependents who are part of your family, and then the annual minimum and maximum contributions, as well as possible carryover into 2026. So a pre-tax account works in that you, rather than having money sent to you directly from your paycheck, instead sign up for the flexible spending account and have that money sent to your FSA. And that money is then not part of your taxable income for the year. So in the example on the screen, you have someone who earned $200, but sent that $200 to their health FSA so that no tax was withheld from it. Neither was it paid to them on their paycheck. It was sent to their FSA account, and it's in their FSA account ready to be spent on qualifying expenses. Now, there are risks to electing pre-tax accounts, because in order to access and use the money that you've sent to the flexible spending account, you must incur and then spend the money from the FSA by a deadline, and you forfeit unspent money. So the plan year ends December 31st, but if your eligible employment ends earlier in the year, you have to incur health expenses before the last day of the month in which your employment ends in order to use the money from a medical FSA. And you can only use the money that's in the account for qualified expenses. When we say you must incur an expense by a certain deadline, We mean you have to have received the service by a certain date, even if you're not paying for that service until some future time. And when we talk about needing to access the money only for eligible or qualifying expenses, we mean that some medical or dental or vision care that you receive or certain child care expenses that you pay for could be eligible to be paid for using your pre-tax flexible spending account money, but not everything that you purchase for those types of expenses will qualify as an eligible expense. And you are responsible for learning how to use your FSA properly. You can visit the company who runs this program, Optum Financial. You can visit their website for lists of services that are considered eligible and qualifying, as well as examples of things that are not eligible. We have on this slide some examples of eligible health flexible spending account expenses. If you made purchases on over-the-counter bandages or sunscreen, they can be eligible, as well as expenses you pay for your doctor's visit or paying for your lab work that goes towards your annual deductible. Those could be qualifying expenses. And for the dependent daycare FSA, certain expenses towards your babysitter or your child's daycare center, whomever's watching your child while you're at work, those expenses could be eligible to be run through the dependent daycare FSA. It's important with FSAs that you substantiate your claims, which means that you must provide documents that prove your expense was eligible if Optum asks for that proof. This is called substantiating your claim. And if you can't provide that documentation, Optum will deny your claim. And if you happen to use your debit card to pay a claim that is later denied, then you must repay that money back to Optum. There is a limited rollover that can be allowed for the Health FSA, which means that if you elected the Health FSA for 2025, and though your employment continues into 2026, you haven't used all of the balance of your 2025 Health FSA, a certain amount may still roll over from 2025 into 2026. There, however, is no rollover for dependent daycare FSAs. You do forfeit any unspent balance in a dependent daycare FSA. A health FSA, if elected, is pre-funded with the entire pledge that you've made for that year upfront. So if you elected, for example, $2,000 to go into your 2025 health FSA, then you'll receive a debit card from that FSA loaded with that $2,000 on it. And then you can begin to use it immediately at your pharmacy and at your doctor's office, and when you pick up a new pair of prescription glasses, and you can spend that $2,000 right from the get-go. However, a dependent daycare FSA does not have a debit card, and it is not preloaded with your election for the year. Instead, you won't have a balance in your dependent daycare FSA until you begin to have money taken out of your paychecks pre-tax and sent to the dependent care FSA. There are very limited opportunities to make changes to your FSA during the year. You have to have only certain qualifying life events that would allow a change, and you have to make sure that we receive your change form within 30 days of that allowable change. There's more information about what types of life events might allow a change on our website and with Optum. In order to access and manage your FSA balance, you will register on Optum's website to reach out through their benefits portal, and you might also download their smartphone app. I find this a convenient way to access your account balances and also to help you pay bills and upload receipts if you need to substantiate a claim. If you enroll in the FSA, it becomes effective the first day of the month following your date of hire. So in the example on the screen, Jane was hired on January 8th, signed up for the FSA timely, and so her FSA is effective February 1st. Now, for you to know how much of a deduction will be coming out of your paychecks for the remainder of the year, go onto the calendar for 2025 and count the number of paychecks remaining for each month in which you will be paid. That might mean skipping the summer months if you're an academic year employee. And that way you can imagine how much will be coming out of your paychecks each time you're paid for your budgeting purposes. The other type of pre-tax accounts are for parking and transit expenses. In many cases, our transportation office here at the UW-Madison can take care of certain deductions pre-tax for us without electing a separate pre-tax account. So for example, you could sign up to receive a Madison Metro bus pass, for which you'll pay $48 per year for unlimited rides, and you could have that charge run through your paycheck pre-tax. You would just sign up for it, purchase it through the transportation website. Something similar can happen for pre-tax parking permits for annual base lot permits. Again, take a look at the transportation website for more information about their resources. Otherwise, if you decide that electing a parking pre-tax account is best for you, for example, you have a flex parking permit that you fill using your debit or credit card monies, then perhaps you could elect the parking pre-tax account for as minimum $50 or up to $300 a month and allow it to reimburse you for certain work-related parking costs. Or if you're in need of a transit pre-tax account, then again, you could elect it a minimum of $50 up to $300 a month to reimburse yourself for certain transit costs as part of your commute to work. Now, these park and transit pre-tax accounts can be elected at any time of year, and they would be effective the first day of the month after we've received your application. So the examples on the screen give a few ideas. In the second example on the screen, we have Tyler, who was hired on March 1st, but he waited a while before he signed up for the parking pre-tax account. He didn't submit his application until September. In that example, then, his parking pre-tax account is effective October 1st, the first day of the month after we've received his application. Now we're wrapping up here, but I wanted to point out that if you incur or expect to incur a qualifying life event, so if you anticipate getting married or divorced, if you're going to have a birth of a child in your life or an adoption, if you're going to be turning 26 and at the same time losing your parents' health insurance, or if you're going to gain new coverage in a coming month, talk to your local HR office or email my office at benefits@ohr.wisc.edu to ask about what changes you may be able to make or should be making to your employee benefits because of that life event. It's very important to reach out within 30 days of the life event so that we can provide you with change opportunities if we can give them to you. For next steps, I would encourage you to review your copy of this PowerPoint presentation. It's available to download as a PDF from our website. You're also welcome to email my office to request that we email you a copy directly. Remember to enroll or waive in your various benefits by your enrollment deadline, so on or before your 30th day. And then in the meantime, reach out to your local HR or to my office directly whenever you have questions about your benefits. And that brings us to a close. So thank you for being part of this benefits session. I hope you learned things that were important to you. And should you still have questions about these benefit programs or how to make your elections, reach out to your local HR or straight to my office. You can reach my office at benefits@ohr.wisc.edu. So welcome to the UW-Madison, and we look forward to working with you. Take care.